Welcome to The Dot, the podcast that aims to bring you closer to the heart of healthcare. I'm your host, Josh Messersmith with Jenna Smalley, and in each episode we'll be diving deep into the world of Wyandot Memorial Hospital, exploring the incredible services that we provide to our community. Join us as we connect with our dedicated medical providers who work day in and day out to ensure our community's well-being. From doctors and nurses to specialists and therapists, we'll bring you insightful conversations that shed light on the outstanding care available at our local hospital. Today, we are thrilled to have two exceptional guests from Wyandot Memorial Hospital. First, we have Tiffany Potcotter, a clinical counselor and psychiatric nurse practitioner. Tiffany specializes in diagnosing and treating mental health and emotional disorders, providing both therapy and medication management services. Joining her is Belinda Longmore, a psychiatric mental health nurse practitioner. Belinda's expertise spans psychiatric assessments, medication management, therapy, and crisis intervention. Tiffany and Belinda are dedicated to mental health and compassionate care who have helped countless individuals navigate their mental health journeys. So grab a cup of coffee, sit back, and tune in as we embark on this journey to explore the world of Wyandot Memorial Hospital.
Welcome to the show now. We're diving deep. Your health and the wellness in your hands to keep. Tips and tricks to know now. Stories that inspire. Living life with knowledge, set your mind on fire. Tune into the dot. Health from head to toe, together we'll unlock the secrets you should know.
Tiffany and Belinda, thank you so much for coming on the podcast. We're so excited to really hear more about mental health services at Wyandot Memorial. We're looking to really talk about breaking down the stigmas behind some of the nuances behind mental health, the services we provide, and how we can really manage anxiety, self-care, and manage those things as best as we can here in our local community. So, Tiffany, can you start a little bit about explaining to us why you chose Wyandot and really why you chose to go into being in mental health services? So what drew you to this field? And Belinda, it's nice because we'll give you a little bit of time to piggyback off of Tiffany.
Thank you, Josh.
Sure. I came into this field over 20 years ago. I started out as a professional clinical counselor, and I did that for about 10 years. And then I kind of got the nursing bug and wanted to go to nursing school. Unfortunately, I sustained a back injury while I was working as an ICU nurse and was told I really couldn't do floor nursing anymore. And so I decided to go back and pursue my psychiatry degree. So that would be less tumultuous on my back, which turned out to be the perfect route for me. Since I already had the counseling background, it seemed to be a good fit. And I chose Wyandot. Actually, at the time, I wasn't even looking for a new job. Ty had called me up a few years ago and said he really wanted to increase access to Wyandot Memorial and was wondering if I'd be interested in at least exploring it. And so once I came on site and I talked to the employees, the administration, and I really saw what Wyandot was all about, of just keeping the service here within the community, I really appreciated what their mission was. And so I decided to take a leap and come over, and I haven't looked back since.
We love that. And obviously talking about access to care and hearing it truly from our most senior executives within the organization saying that we are prioritizing mental health and the services that we're able to provide our community right here was a great point to get to. So Belinda,
Yes, thank you.
Tell us about you.
Yeah, so first I want to just add to what Tiffany just said is that the commitment of this hospital to the community is so very impressive. And I've just been here since January, and every single day I have so many patients that are grateful for these services that are here. And I think that we're all very fortunate to be working together to improve the well-being of the community. Back to how I got into mental health. On and off throughout my entire nursing career, I've worked in mental health, all different age groups. And ultimately, I ended up going to nurse practitioner school to specialize in mental health after all of my children were grown and headed off to college themselves. So I was very fortunate. My very first clinical preceptor was, in fact, Tiffany Podcock. So she really set a foundation of me being a very good provider. She taught me provider practices that are safe and caring and beneficial to helping patients on an outpatient basis. And I used that as I continued on with my education, did a lot of inpatient care, and then received some contact from Tiffany. I guess we ran into each other at a conference, and she said, "You need to come work with me." And I said, "No, I don't. I love my job." And it was because she needed extra help here at Wyandot because she was so busy and so many people needed her assistance. So she kept at me for just about a year. And finally, I thought, I was working inpatient in the Toledo area, but the beauty of being in a community, and it was very appealing to me, and establishing a relationship with patients more on a long-term basis. So she and the administration invited me down for a visit, and I got a very nice welcome and a really good feel. Like right out of the gate, I got a good feel. And you all have not let me down. So thank you.
Well, good. No, that is great to hear too. And to know that Tiffany was able to engage you and be able to express how great of job we're doing here, and that there truly is a need for mental health services in our community, and that it was obviously great enough for us to bring you along and be able to have Dr. Richards now on and assisting with the large inflow of patients that we have is amazing. And so I have heard nothing but great things about you all. Unfortunately, I haven't gotten to meet you all in that capacity yet, but I'm sure I'll filter through all three of you at some point. So we talked a little bit about it already. Let's talk about stigma. How do you think that we can work together to reduce the stigma surrounding mental health issues and in our society? We are a very rural conservative area. So how do we break down those barriers here? Obviously, one of those steps is right here talking about on this podcast. But how are there ways that we can promote positive health, well-being, talk that mental health services are normalizing mental health services a little more for our patients?
I think some of it we're already doing when patients come in to see their PCP. Everyone's getting screened for depression, anxiety, suicidal thoughts, and to make that part of the normal process, because we are a whole self. We're, mental, physical, spiritual. There's lots of parts to us, and we can't ignore one without addressing the other. So we just have to talk about it and not make it such a taboo topic. And because honestly, that's how a lot of patients come in here on referrals. Someone sees Belinda or I, they have a good experience or they start to feel better, then they go tell someone they had a good experience. And then that person refers someone who they know they've been struggling. And it's a domino effect, then we start to get circles of people that come in because they're actually sharing their experiences. And we have to normalize, we all go through bouts of depression or anxiety. Like we can't get through life without a stressor happening. It's just going to happen. And there's nothing wrong with saying like, I need a little bit of help in processing that. And Belinda and I too, just because we're working in the field doesn't mean we're immune to all of this. Like we've been through this, we understand how it works. And so we can offer, coping skills. We can't stop the bad things from happening to people, but we can at least walk your journey with you and give you coping skills and tools to use along the way. Because if you don't, the outcome is your quality of life decreases. If we're willing to go to the doctor for a bad headache or stomach ache that we just can't take anymore, why not our mood? Like, why not live your best quality of life feeling good and addressing the things that need to be addressed? So a lot of that stuff, maybe happens in childhood. Maybe you never even learned coping skills in childhood. And here you are as an adult and you have all these emotional responses and you're like, I don't know how to handle this. And so we're just here to help you and say, yeah, you probably should learn this along the way, but it's not too late. And let's change this generation and make it better for the next generation.
So Tiffany, I love that. And Belinda, can you give us some of those maybe practical tips that we can use for maintaining good mental health in the day-to-day? So are there some short-term things that everybody can practice every day for us to use?
Yeah, so number one, I always address sleep first. Sleep and appetite are where I'm always going to start. Those are just our basics, so we need to attend to those. Really good, healthy sleep hygiene, good, healthy foods, exercise, and really to start there. It's important to also have a frame of mind. This is one thing I try to encourage every patient is first thing in the morning, have some sort of affirmation, something that's very positive, whether it's about your surroundings or yourself or a friend, a family member. It can be even as simple as smelling fresh coffee, as long as you say to yourself, that smells wonderful. To just try to put that one positive thought, it helps to kind of jumpstart your day. So those are some of the very basics.
I love that. I think, that the idea of waking up in the morning and starting it off on a positive note. I'm guilty of it. I am a horrible sleeper. So I automatically wake up and I'm like, oh gosh, here we go again. But then once you're into the day and you wake up, but if you can truly start it off on a positive note, it's always good. So thank you for those
Certainly.
tips.
The next question I have is, we often hear about the mind and body connection. So how would you say that physical health and mental health intersect in a way?
Oh, that's so very, very strong, the intersection. Frequently, the first one that I think of is stress and anxiety will lead to physiological changes. It will impact your gut, your appetite. It can lead to nausea, vomiting, diarrhea, and those are all very real. I had a very lovely preceptor once who used this as an analogy. Is we would never say to someone that has diabetes, you don't need your insulin, you'll be fine. Just tell your pancreas it's just fine. Mental health is exactly the same thing. We can't just dismiss the depression and the anxiety because the physical well-being and the mental well-being go very much hand in hand.
Yeah, I think a lot of people have the wrong view of mental health of there's something wrong with them, that they have some control over certain things that happen to them, but they have to realize that trauma changes your brain. It changes your brain chemistry. It changes the way you deal with things. And sometimes that leads to chemical imbalances that just need to be fixed, that the brain can't rebound from without help. So sometimes just educating the patients on, hey, this isn't your fault. Like, it's another organ of the body, just like your pancreas or your liver, and it's not functioning the way we'd like it to. So we just need to help you fix it and get it balanced so that it can, make better decisions and make you feel better. So I think patient education is huge. And just like Belinda said, hey, what are you doing for eating and exercise, and all those things impact your mental health every day. So it's important to just have them leave with a piece of knowledge of what they can do that isn't their control.
One of the things is that's probably the biggest misconception, right? Is that something's wrong with me. What am I doing wrong that I can fix it? And sometimes it's not. Like you said, it's that medication imbalance or some type of chemical imbalance within you that you can't fix that on your own.
Mm-hmm.
So it is okay to come in and have that conversation and talk with you all about what that looks like. So, when we talk about mental health, I am the first person that's like self-care. I got to take a self-care day. So what does self-care mean to you personally? And then how do you integrate self-care into your life? Is it a work-life balance? Is it, I'm doing a spa day? Jenna and I were just actually talking earlier about, she's like, I need a massage. And I'm like, girl, me too. Like, I want a massage too. So I'm like, we need a massage day, or I need some type of Botox therapy or something. I need some type of, that is my self-care. So can you guys give us a little bit of tips that you guys do for your self-care?
Work-life balance is huge. We both work part-time, so we have our days off. But good boundaries with learning to say no to extra things, extra activities. Self-care is going to look differently for everybody. My self-care routine might be different than Belinda's self-care routine. But also realizing when you do need a day off, when we have sick days.
Yeah.
That includes physical and mental health. A headache is the same as I'm so anxious I can't get to work today. It's hard to leave my house. That's a sick day. That's okay to recognize that. Or, gosh, I'm just feeling really overwhelmed. I can't make it in to work today. That's fine. That should be encompassed under sickness, because sickness does include physical and mental health. So knowing when you're getting to that point, so hopefully you don't get to that point. But just to piggyback, obviously I make sure I get good sleep. Doesn't always happen with kids, but I do my best. Watching what I eat, talking to people, having my outlets, not being socially isolated, making sure I'm connected to others, and that I have another life outside of work. That I have plenty of activities that everybody's identity should not be their work. Your identity should be your character, things about you that are intangible that aren't going to change, because there's so many things in our life that are ever changing, and that could really plummet your self-esteem if that goes away. So really just working on building your character and your connections outside of work and having an identity outside of work.
Just to piggytail onto that, really whatever brings someone much joy is what you need to make sure you find personal time for. The first thing that comes to my mind, however, for me, I love to walk. And so if you can get outdoors where it's peaceful, even if you're not a walker, but just to sit and really focus on wilderness, mindfulness, not bring your telephone, not have headphones on. I think often right now we're so busy and inundated with the media and news, all the things that are out there right now, and it's contributing an enormous amount of stress to each and every one of us. So it is very important on a daily basis, even if it's just a couple of minutes, turn it off, don't look down, look around, and find just some quiet time. Mindfulness. It's important.
I love that you talked about it. One of my self-care routines is I love TikTok. So I scroll on that TikTok all day long, when I need a minute. But so one of the questions is, with the rise of social media, people are experiencing a lot higher levels of anxiety. So what advice do you have for managing that mental health within the social media era for young people?
Social media is a double-edged sword because it has positives and negatives. I mean, people find some real good connections on social media, and it is nice, if you're bored to scroll a little bit, and, that could be a coping skill for some people. So I think that's perfectly fine. But if you're using social media as a way to escape or maybe vent to people that you aren't actually connected to, then it becomes more unhealthy for you. And just monitoring how much time you're on it. If you're not getting your stuff done, you're not prioritizing, and you're finding your screen time every day is, 5 to 8 hours, then that might be a problem, which some of us use our phones for work. I do
feel personally attacked. Because when at the end of the week, when the iPhone tells you this is how many hours you're on your phone, I'm like, oh my gosh. So then I look at it, I'm like, oh, right. TikTok was pretty high this week.
But that can also, I would do that too if I'm feeling stressed or I'm just trying to unwind. I might scroll and, because certain things make you laugh and it takes your mind off of things, and it's funny and it's engaging. But then you got to realize if you're 2 hours in, oh shoot, I need to stop scrolling here for a while because I'm not getting my stuff done.
As I'm not sleeping, it's 2 a.m.
Right.
And I'm deep down a rabbit hole of something on TikTok. But Belinda, how do you feel about that? Do you think of any? Do you know of any tips that would come from somebody who is, I think, okay, I had Facebook when I was 16. I cannot even imagine my 3-year-old niece or nephew having Facebook. Social media is at their fingertips all day long. Mm-hmm. So how do people manage, keeping kind of the double-edged sword away from some of the younger people in our population?
Absolutely. Communication, open communication between the young people and whoever is in their life, their mentors, their parents, their grandparents, because like Tiffany said, there's both positives and negatives. So like anything in our life, a fine balance between the two. So.
Yeah, if you find yourself feeling worse after being on social media, it's probably not good for you because, it's a compare zone of what are they doing? They're having so much fun, but you have to also realize that's just a snapshot in time. It doesn't actually reflect people's reality most of the time. And, you can't use it as a means of social comparison. If it's just, I want to be entertained for a little bit, that's fine, but not to build your self-esteem off of.
So we know that mental health is a journey. It's not just a destination. It's something that you really have to work. So we talked about those short-term things of what we can do in the now of prioritizing positivity, finding easy successes that you can really focus on. But what are some of those long-term strategies that somebody could have for mental well-being? And also, I would assume one of those is talking to a mental health provider. How does somebody go about selecting the right person for them?
I think one is referrals. If other people maybe had a good experience, first start with referrals, but also too, just make an appointment and going to see if it's a good fit. We realize we're not a good fit for everybody, and that's perfectly fine. We're not wired that way to be a perfect fit with everybody. So if you try it out and doesn't feel right, you can go see somebody else. We are fine with that, and we understand that, and we'll help facilitate you finding the right person for you.
Is it common seeing, maybe I come in and I see Belinda, and then after the first couple of sessions, I'm like, you know what? I'm just not connecting. Is it typical for somebody to get the right mental health professional the first time?
So I will say that is not typical between the clinic here. I think that the fit with most of the patients in this area has been very, very good. But I can share that I always speak with people about just feeling like you belong with this provider. And I say, it doesn't matter if it's the dentist or your primary care or a therapist. If it doesn't feel right, how are you going to really get better? I mean, we have to really feel good about an experience, and our brain has to be functioning with the right neurotransmitters to get well. So I always encourage people, if they're seeing a counselor or someone, that they just say, I'm not sure if it's going well. I encourage change. And there's nothing wrong with that. I certainly would never be insulted if someone said, I feel like seeing someone else. That's absolutely fine, because our goal is to get people to feel better. That's our goal.
And sometimes feeling better is they may not leave our session happy because we have to point out truths. And good self-reflection of is this not a good fit because we're sharing truth with you? Or is this not a good fit because our personalities are clashing, So giving them realistic expectations that not every session is going to be hunky-dory and you're going to feel, skipping out of our office. You might be really faced with some truths of learning how to change your thought process and rewire your brain. And it can be heavy. You can leave not feeling the best, but still know you're working on things. And sometimes you have to go through the storm to get to the rainbow.
I love that. So as we're wrapping up, what is one key takeaway or piece of advice that you would like anybody who is listening to this podcast remember when it comes to caring for their mental health?
It's every bit as important as your physical health and well-being.
Yeah. Do it for your generation, the next generation. Know that one person has the power to change a whole family, a whole community, your friends. Just one person getting help and talking about it and making changes can really be impactful. So just trust the process and just try it and see if you like it.
I want to thank you both for coming on to this, thinking outside the box with us, since this is a new initiative within the hospital that we're doing for the podcast. But thank you both for coming here, taking the time, really helping us have the conversation about mental health, that helping normalize seeking mental health services, especially in our community, and being able to do that. I appreciate you all. I have learned a lot. I'm going to take my TikTok from 2 hours a night to maybe an hour and 30. But I definitely really appreciate you guys coming on and being a great representation for our hospital. So thank you very much for everything you do.
Thanks for having us.
Indeed.
We hope you enjoyed our conversation with Tiffany and Belinda from Wyandot Memorial Hospital. Their dedication to mental health and their compassionate care truly highlights the exceptional services available at the hospital. Remember that mental health is just as important as physical health, and seeking help is a sign of strength. If you or somebody you know is in need of support, don't hesitate to reach out to any of the professionals at Wyandot Memorial Hospital. Thank you for joining us today, and we look forward to bringing you more stories and insights from our incredible team of medical providers in the future. Until next time, stay healthy, stay informed, and take care of each other.
The secrets you should know.